Good afternoon. This is the Thurston County Board of Health for Tuesday, November 6, 2018. I'm Commissioner Bud Blake, Chair of the Board this year. I'll start off by doing a few introductions. To my left is Commissioner Gary Edwards. To my right is Commissioner John Hutchings. To his right is Lydia Hodgkinson, the Clerk of the Board. To her right is Shelley Slaughter, the Director of Public Health and Social Services. He's cracking me up. And then to her right is Ramiro Chavez, County Manager. With that in mind, I call the meeting to order and ask if there's an approval for a motion to approve today's agenda.
Mr. Chair, I move to approve the agenda of the Board of Health for November 6, 2018.
Second.
It's been moved and seconded as stated. All those in favor say aye.
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 Aye, and that motion carries. And is there a motion to approve the meeting minutes for September 11th and the summary meetings for September 11th, 2 October, 9 October, 10 October as attached?
As soon as I get to it, yeah.
I'm losing my stash.
Okay, Mr. Chair, I move to approve the meeting minutes from September 11, 2018 and acceptance of work session summaries from September 11th, October 2nd, October 9th, and October 10, 2018.
Second.
It's been moved and seconded as stated. All those in favor say aye.
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 Aye, and that motion carries. So we have one proclamation, one presentation today, and it is absolutely great to be able to have Mr. Jacob Bryson back. He's going to tell a little bit about the Male Breast Cancer Coalition. But in the meantime, we have Liz Davis, who is the Division Director of the Child and Family Community Wellness here at Thurston County. And Liz, tell us a little bit about the proclamation in Movember.
So the proclamation before you today is to declare November as Movember. So the history behind that is that in 1999 in Australia, there was a group of men who got together and decided that they were going to grow mustaches in the month of November to raise money for charity. And then in 2004, that idea was taken to the next level to raise money and awareness for men's health and men's cancers during the month of November. That group later became the Movember Foundation, and the members of that coalition call each other the Mo Bros. So in Australia, the nickname for a mustache is a Mo, so that's where they got that from. The Movember Foundation has since raised over $174 million for awareness of a variety of men's health issues. So all of you have some lovely mustaches today, and we also have a basket of them for the crowd. We know that men are at higher risk than women for certain cancers, also for suicides, and that they have a shorter lifespan in general. And more than 3/4 of men in Thurston County are overweight or obese. And we know that physical activity is a key factor in increasing men's health and also achieving a healthy weight, reducing the risk of heart disease, diabetes, and more. And so that's another reason why we have the word move in Movember, to encourage men to get up and move, to be healthier. So today we have with us Mr. Jacob Bryson from the Male Breast Cancer Coalition, who's a passionate advocate for men's health. I've had a fabulous time talking to him during the break, and he's here to talk to you more about men's health.
Hello, sir. How are you doing there?
Good afternoon. My name is Jacob Bryson. I would first like to thank the Commission for this invitation. This will be my second year here to speak to you. I am passionate. I'm very passionate about male breast cancer particularly, but I'm here to talk about more than just male breast cancer. Let's talk about the cancers that are specific to men. Let's start with prostate cancer. Prostate cancer is extraordinarily easy to determine whether or not you're at risk. You hit your late 50s, early 60s, and suddenly your urinary habits begin to change. You have difficulty starting, you have difficulty stopping, you have to go to the bathroom much more often, and particularly at night, it's time to go and see your doc. Your prostate is probably enlarged. You may not necessarily have cancer, but your prostate is probably enlarged, which is a kind of a harbinger of the possibility of developing cancer in your prostate. Very, very interesting, however, most prostate cancers can be cured. The survival rate for prostate cancer, 15 years and greater, is 96%. So it's not such a dread disease as one might expect. Let's talk about testicular cancer. I'm a testicular cancer survivor. I was diagnosed in 1999, and it became imperative for me to begin touching my own testes because they hurt, and I didn't understand it. One of the biggest problems, for me at least, in terms of men diagnosing themselves, or at least becoming aware of some problem going on, is we don't, as men, typically touch ourselves. And if we do, it's probably biblically not okay. And that prohibition works against us. If a man's testes are sore, pulled up tight against his body, any number of kinds of changes, it's imperative that that man go and talk to his doctor about what's going on in his reproductive cycle. The good news about testicular cancer is it's very rare. 5.7% or 5.7 men out of 100,000 will be diagnosed. Typically in your 15 to 35, but there's another spike at around age 60. So becoming aware of your body, being aware of your body, constantly aware of your body is essential if we're going to survive the kinds of cancers that I'm talking about. I was on a couple of websites earlier today and looking for any information about men's cancer. There's very little information out there in terms of the cancers that are particularly male in their relationship. We need to start that conversation. That dialogue has to start. We, as men, need to begin talking. I don't know that there's a woman here in the room that doesn't understand that you do self-breast exams. I suspect that every woman in the room, and probably 75–80% of the women in Thurston County, understand that self-breast exams are important. So let's talk about male breast cancer. My wife is here with me, my wife found my tumor in my right breast, just adjacent to my right nipple. Having said that, I was talking earlier, and men don't typically have this kind of discussion. We don't use words like, my testicle is sore. We don't say that to one another. We don't say it to our doctor. We don't say it to our wives and our friends. We don't talk about, I have a lump under my nipple. Those kinds of discussions just don't happen, and it has to happen. There's a lot of research to suggest that a higher estrogen level in comparison to the testosterone level in a man's body will lead, or has a greater likelihood of leading to breast cancer. As a result, I think, of having my orchiectomy in 2000 and losing one of my testes, my testosterone level was lower in relationship to my estrogen level, which may then have caused a greater likelihood for me to develop breast cancer, which in fact I did. It's critical, particularly in men, if there are family members, close family members, blood relations, who have breast cancer. Every man needs to go and have his blood sampled for BRCA1 and BRCA2. That's the breast cancer 1, breast cancer 2 genetic markers that will accurately predict your chance of developing breast cancer. Just because you happen to be BRCA1 or 2 positive doesn't mean you're going to develop breast cancer, but your chances are much greater. 50% of men diagnosed with breast cancer have a mother or a father or a grandparent who is diagnosed with breast cancer. 50%. Those are pretty big numbers. If a man is BRCA1 positive, 6 out of 100 men will be diagnosed with breast cancer in their lifetime, if you're BRCA1. If you're BRCA2, 1 in 100 men will be diagnosed. Something more important to me about male breast cancer than other kinds of cancers is the mortality rate. Most men aren't diagnosed until they get to stage 3 or stage 4. Once you're at stage 3 or stage 4, your incidence of mortality rises dramatically. About 75% of men diagnosed with breast cancer are fatally wounded and will not survive the disease. There's some interesting information I've discovered, I've just heard, that 10,000 persons, first responders and persons who worked on the ground zero, 10,000 of those people have developed cancer. 15 of those people have developed breast cancer, and they were men. 15 people working around ground zero, 15 men developed breast cancer. So it's not about nature as opposed to nurture. In my opinion, it's both. I have breast cancer in my family. I have breast cancer. My daughter has breast cancer. My son is being evaluated for breast cancer. I grew up in Trail, British Columbia. Some of you may or may not know that Trail, British Columbia used to be the home of Cominco, which was the world's largest non-ferrous smelter. I grew up there, breathing that air, breathing the effluents that came out of that smelter, drinking the water out of the Columbia River, which we're still trying to clean up. So one needs to be aware, what's going on in my family, and where did I grow up, and where do I live today? And thankfully, the Thurston County Department of Health and Thurston County Commissioners are working to look at our environment and make sure that our environment is safe and healthy for us and our children. Thank goodness for that. My bottom line message is, men, you've got to learn to touch yourself. It's okay. No, you're not going to be struck by lightning, but you might be if you don't. 2,470 men will be diagnosed with breast cancer this year in 2018 in the United States. 75% of those men will die because we're not doing soft breast exams. Okay, there are other breast cancers that you're not going to feel a lump. That's true. There are many other kinds of breast cancers other than tumors. But if you're experiencing, like my son is, some discharge from your nipple, talk to your doctor. If you're experiencing some soreness, redness, swelling under your armpit, next to your breast, talk to your doctor. Talk to your partner, your spouse, and be aware that if you diagnose it soon, early in your life, your chances of survival are 100% better. I don't know what else to say than cancer is insidious and it affects everyone. Every last one of us is at risk for developing cancer. Men are at risk of developing some very specific cancers, prostate and testicular cancer, which are typical to men, not to women, and breast cancer, which up until recently has always been a woman's disease. Just ask Susan Komen. Men get it too. So let's develop that conversation. Let's have that conversation. We need to talk. Thank you.
Okay, we have a couple questions for you. And
yes,
then,
I don't know so much as I have a question, Jacob. I just want to take this opportunity to recognize you and thank you for having the courage to come forward and talk about a very difficult topic that it apparently is to talk about, and being that role model, that letting us know maybe that we better be a little more vocal with our loved ones and ourselves. So just thank you very much, and I'll be glad to get this mustache off.
If I could respond, Commissioner Edwards, I would say that the first 2 years after my mastectomy, I wouldn't go outside of the house without a shirt. for another 2 years, I wouldn't go out in public without my shirt on because I'm scarred. My ex-supervisor started a rumor where I used to work before I retired that I had gone for breast augmentation. My ex-boss said to me, well, what's the big deal, Jacob? Men don't need tits, quote. We need to start this discussion. So thank you, Commissioner Edwards. I just elevated your office.
Yeah, okay.
We'll take it.
Mustache looks good on you, Gary.
Yeah.
That's a keeper.
Jacob, thank you very much. You're fascinating to listen to, and you have a bold message that you're not afraid to disseminate and give out. And one of my best friends, my closest friend from Olympia PD, we were partners for dozens of years. In '86, in our early 30s, 1986, he was diagnosed with testicular cancer as well. And he's alive and well today because they caught it in time. I learned a lot from him too, and I still do. And being a cancer survivor myself, the information you're giving out and you're not afraid to do it, you just do it. And I think it's very bold of you, and I'm appreciative. This is the second year you've been here to do this, to talk with us and talk with the community. Thank you very much, sir.
Thank you, and I'll keep coming back as long as you let me in the door.
Well, before you walk away, tell a little bit about the Male Breast Cancer Coalition and how one can hear this and get involved, start that conversation in a more formal sense or informal, whatever it takes, obviously, but just where can one go and include the Living Beyond Breast Cancer piece of this too?
Here in the Thurston County area, and in fact in Western Washington, your only contact for the Male Breast Cancer Coalition happens to be me. It's a hell of a burden. I would like to see every physician in the county, every physician in Western Washington, every oncologist, every radiologist, when a man presents with concerns about breast cancer or is diagnosed with breast cancer, call me. We have a huge organization. I happen to be the only one in Western Washington currently, but as you can imagine, if 1 in 8 men are going to be, 1 in 800 men are going to be diagnosed with breast cancer in their lifetime, there has to be more than me somewhere here in Western Washington, and I don't know where those people are. When I was first diagnosed, I looked for help. I looked for any kind of support that I could get, and there was none. And then a young man by the name of Brett Miller, who was diagnosed at 17, made the assertion that no man would ever be diagnosed with breast cancer without some support and help. And he started the Male Breast Cancer Coalition, which in the Midwest states and on the East Coast comprises hundreds of men. We're getting our message out. It just doesn't seem to be, there's not enough time in the day for me to contact every doctor and every radiologist and every oncologist in Western Washington. But I'm trying. I'm out there talking to the radiologists, I'm out there talking to the oncologists, I'm talking to my doc, and I'm getting referrals to talk to other docs. The message has to get out. I'm 70. I don't know if I'll get it out before I'm gone, but I'm working on it.
Well, you wear that well.
Thank you, sir.
Yeah.
Thank you.
Yes,
All
thank
right.
you.
Thanks for the invitation.
Well, come on back, yep.
Proclamation.
Oh, yeah. Jacob, we forgot the proclamation. We want to read it.
And then we need a photo.
Your photo, yeah. Go ahead.
He's coming back.
Sure.
All right, I'm going to go ahead and read it while you're walking back. Whereas across the world, men die an average of 6 years younger than women, and in Thurston County, 3 years younger than women. And whereas the deaths are largely preventable, and we can all take action to live healthier, happier, and longer lives. And whereas 28% of Thurston County men do not have adequate social support, support to speak up and speak out should not be a stigma, and reaching out is crucial. And whereas in Thurston County, last year, 43 men died by suicide. 70% of all suicide deaths are men, and the suicide rate for men is higher compared to women and other men in Washington state. And whereas the top 2 leading causes of death for men in Thurston County are cancer and heart disease. And whereas out of every 100 men, 13 will be diagnosed with prostate cancer in their lifetime, and the average age for being diagnosed with testicular cancer is 33. And whereas in Thurston County, only 23% of adult men are at a healthy weight, and 40% of men are not physically active enough or are inactive. And whereas moving can reduce your risk of heart disease, diabetes, and cancer by up to 50% and lower your risk of early death by up to 30%. And whereas Thurston County joins communities across our nation in challenging men to grow a mustache or make a commitment to get active and move, and encourages women to support this effort in order to spark conversations and raise vital funds and awareness for men's health. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims November as Movember to increase public understanding of the importance of men's health, and urges all members of our community to recognize this significant occasion and join the movement to change the face of men's health. Adopted the 6th day of November 2018, signed by your Board of Health Commissioner.
Ta-da.
Yeah. Yay.
Come on up. We're going to get a photo. Ramiro, you want to come? Jacob, if you'll do us a favor, stand right here in the middle and do
Jacob's the only one that looks natural.
about face. There you go. Hold it up in like a V
Good on
shape.
him.
There you go. And Shelly's here. Shelly's going to be on your right shoulder. Turn this way. The camera's going to be that way.
Yeah, it looks good on you.
Do a half right. No, half right that way. There you go. A little bit more. A little bit more. There you go. All right. Come on in.
Come on. There you go.
One more with the wife. No, come on over. Yeah.
No?
Okay.
One more without her.
Thank you. All right. Thank you, sir.
Thank you.
Very kind of you.
Very, very much.
Very good. Thank you, sir.
Okay, that's fantastic. Now, item number 3 is the opportunity for the public to address the board. And I'll ask if there's any sign-in sheets or anything. Romero, did you by chance see any sign-in sheet? No? And by show of hand, and anybody in the audience would like to come to the podium, show me your hand. No, seeing no one on either occasion, we'll go on to item number 4, which is the department item. And we have a Thurston Thrives update. It's an area emphasis update. And we have Crosby Carter. She is the director of Thurston Thrives and staff. So Crosby, come tell us what an area emphasis is and what does it mean to Thurston Thrives.
Hello, good afternoon. Thank you for having me here. So yeah, I'm Crosby Carter. I'm the new director for Thurston Thrives. Ooh, that's loud. I've been here for about 4 months now, so I have a nice learning curve, and I'm really excited to start diving into what it means to be Thurston Thrives in our community. Overall, Thurston Thrives is a community initiative. It's not a standalone entity. We are built on partnerships and trust, looking to engage our organizations and our leaders to improve our community's health overall, but really understanding that health is more than healthcare. As was discussed earlier, health is the supports available in our homes and our communities. Health is determined by our ability to afford housing and make a living wage. Health is the quality of our schools and the safety of our children, and health is the cleanliness of our water and our food and our air. So health encompasses just about everything we do in our communities. So at the heart of Thurston Thrives are our action teams. We have 8 of them, and these teams are all working together to address the different areas of our community's health. And their main goal is to help ultimately ensure that Thurston County is a thriving place to live in our community for current and future generations. Over the last 9 months, Thurston Thrives, the teams and our coordinating council, which act essentially as our board, have been working together to dive into what does it mean to be working in community health? What are those really complex issues that tie climate change and housing and education together? What's that kind of that nexus area that all of these teams are impacted by? And ultimately, those areas were identified and decided on at the last month at our coordinating council meeting as revolving around housing stability, the success of children and families, and economic opportunity. So what that means, it doesn't mean that any of the teams are going to stop functioning, because again, health is the whole spectrum. What it means is we're really looking at how can our coordinating council delve into these issues better and help our community engage and understand what it is we are working towards, which is our areas of emphasis. Now, going forward, our next steps will be starting to dive into what does it mean to have these nexus areas? What does that mean for our teams? Then we're going to be looking to help define some maybe policy priorities we can be acting on, looking at different areas and metrics we can be measuring. Thurston Thrives, through each action team, already measures actions. They're called our strategy maps. But now we want to see what can we do to further those strategies? What can we be really doing that's data-driven solutions and actions that we can actually be accomplishing through our teams? So what I will say and I'll leave you with is what we do, collective impact. It brings governments and businesses and philanthropy and citizens all together. It is messy work. It's imperfect. It's people, and we're learning to build trust and relationships, because ultimately no one sector can solve these complex issues alone. Homelessness, poverty, health, food safety, all of those things really come back to partnerships and being able to step outside of our lens a little bit and really see what different strengths a government representative and a nonprofit at that table can bring together, and see how we can make better partnerships going forward. So ultimately, when we look down to what is Thurston Thrives, because a lot of people ask me, well, so what is Thurston Thrives? I understand you exist, but what are you doing? And I don't blame them. That's a good question. But ultimately, it's really about bringing all of those sectors together to form better partnerships, like I said, build trust, to inform regional policies. How are we as a region functioning? How are we as a region working together? And develop innovative actions. We have, like I said, all those 8 action teams, and each of those teams are coming up with really unique ways of addressing our problem, because where else are you going to have a private developer sitting down with a local jurisdiction and a nonprofit talking about how can we solve housing affordability together? And that's what Thurston Thrives does, and we bring those people together to say, hey, how can we do this differently? So I wanted to give a really short and sweet presentation. Because I recognize your time is precious. But I hope I can at least convey that while we are not an entity, I can't say that we are formed in this bubble, but we are a network of people who have great ideas coming together and who want to build trust to do something different in our community. So happy to have questions.
Any comments or questions?
No, nothing more than just to say thank you for your efforts, and I like your picture up there on because those kids, obviously are our future. So thanks for what you do, Crosby.
Thanks.
Same thing, Crosby. I love what you're doing with Thurston Thrives, and in conjunction with public health, and what we're doing here as the county, and working together in resolving and solving and addressing our community needs in an aggressive, intelligent manner. Thank you very much.
I will say that public health is an integral partner in Thurston Thrives. This initiative was born from the Public Health Department and now is backboned by the Thurston County Chamber. But all that means is that the Chamber is a fiscal sponsor, and public health is really helping give that body of what does it mean to look at our health from a holistic 30,000-foot view.
Yeah, thank you very much.
So I'm going to take you in a little bit of direction. You'll know what I'm talking about as far as the coordinating council, a new location they meet, how people can get involved, open to the public. Can you elaborate on that as far as the coordinating council, and give a little bit of background on it, and then we can, I have a question about action teams.
Absolutely. So the coordinating council is essentially like the umbrella board over Thurston Thrives. I apologize, I talk with my hands. It's the Italian, I can't help it. Yeah. But it's the umbrella of how Thurston Thrives is looking at the bigger policies. What makes this a really unique body is it is made up of representatives from each of our jurisdictions. So we have 6 government representatives. We have representatives from business, from philanthropy, meaning the foundations and United Way, for example. We have representatives from the education sector. And then we bring together representatives from each of our 8 action teams. So we have really a diverse perspective on who was on this council. And then we bring in 2 different members at large who have a different skill set that might already be at that table. And the idea is through this collective wisdom that they all have in the different sectors, they're able to look at that 30,000-foot view of what's our community doing? How are our action teams functioning? What do they need? What can we be doing differently? Do we need, the idea from an area of emphasis came out of that concept of how do we help give our teams a better sense of identity with each other and with Thurston Thrives as a whole, so that we can start actually maybe going to that coordinating council with some ideas, and they can help through that wisdom and power that sits at that table, really move some agendas forward. They meet over in Lacey at the EDC/SPSCC building. It's every third Monday of the month, so I think the next one is November 19th. It's at 3 p.m. And it's about 2 hours, although I always try to get people out early because it's a long day. And it's really about then diving into those issues better at that time and looking at, okay, what's next on our agenda? Right now they're going to be diving into that area of emphasis and saying, okay, so now we have this area of emphasis, those 3 things. What does that mean? And how can we start teasing out some policies we want to be impacting as a whole?
Great. Thank you very much.
One of the teams, Crosby, is deals with children in education and wellness as well.
Yep. So one of the teams right now is called Education and Resilience. What that team is doing right now, though, is going to step back and say, okay, so we have a strategy map. How can we be bringing new people to that table? The power of Thurston Thrives rests in the action teams. It's really where that cross-sector innovation is happening. And we're looking at that team of who's missing from that table, what new ideas can we be having? Because as Commissioner Edwards said, and I've heard him say multiple times, our youth are 100% of our future. So we need to be looking at graduation success, not just reading, but then what happens after graduation? Is it college? Is it vocational training? Not every kid is meant for college. What does that look like in our community? And especially the kids that we have here, how are we growing them to be civic members of our community, investing their time, their energy, their livelihoods here? So that's what that team will be diving into in the next year.
Thanks. I love that focus.
Yeah.
Is one of the other teams Housing Action Team?
Absolutely. We can talk about it if you want.
No,
Okay.
it's good.
Anything else?
Anything else?
Nope.
Good.
So
Thanks, Crosby.
we always welcome anybody to join. These meetings are all open. So each of the teams, we now have a fully updated calendar on our website. So you can go under our calendar and see when each of the teams meet. So if you're curious what it means to be part of the Housing Action Team, pop into a meeting. If you're curious about climate change and energy, but maybe you aren't an expert, but you want to learn, go. There is an insane amount of expertise that attend these meetings, and you'll learn a lot.
So it's 2 p.m.?
3 p.m.
Which Thursday?
So
3 p.m. Which Thursday?
on Monday, the
Oh.
3rd.
I should be taking notes. That's why I'm-
Coordinating Council is the 3rd Monday of every month
Okay.
at 3 p.m. in
At
Lacey.
SPSCC and EDC.
The Lacey campus.
On 6th Ave.
Yes.
Yeah.
I'm learning to lead with the word Lacey because I keep saying SPSCC Lacey campus and people forget the Lacey part.
Oh, okay.
So Lacey.
Lacey, got it. Thank you.
Yeah, thank you guys. I appreciate it.
Yeah, we'll see more of you.
Absolutely.
Thank you so
Thanks.
much, Crosby.
Thank you.
So item number 5 is a department item, and it's a description is to, a joint plan of responsibility agreement with the Washington Department of Health and Water Recreation Facilities. We have Mr. Sammy Burr from Environmental Health, who's a specialist, senior specialist at this, and he's going to give us a little background and how this all happens via staffing.
Yeah, thanks for your time. Basically, we have an agreement with the Washington State Department of Health to jointly look at pool facilities in the county. And essentially, this is a renewal of an ongoing relationship that we've had in place since at least 2006, and it's worked well for both parties. And we've tweaked it a little bit just to make it a little more clear about responsibilities. But basically, it takes good advantage of them having a small number of staff, basically 2, that do engineering level review of pool facilities as they're planned. And then we at the local level have the staff to then go out and do the inspections and then do annual permits and make sure that once built, the pools are maintained in an appropriate way. So it's a nice balance of work, and it works well for us and for the state, and we're looking to continue that practice. The nice part about it also is that this is a zero, there's no funding component to this. It's just merely an agreement based on how we're going to divvy up the work.
All righty, questions of Sammy?
No, thank you, Sam. Appreciate it very much.
Sure.
Thank you, Sammy.
All right, well.
Any financial transactions, or is this just a kind of a mopping up piece there?
It is strictly agreement about how the work is going to be divided. There is no financial one way or the other.
Okay, great. Is there a motion to approve?
Yes, I move to approve the Washington State Department of Health Joint Plan of Responsibility Agreement number CLH18264 for water recreation facilities from the date last executed until January 31, 2025, and authorize the Director of Public Health and Social Services to sign the agreement.
Second.
It's been moved and seconded as stated. All those in favor say aye.
Aye.
Aye, and that motion carries. Thank you
All
very
right,
much.
thank you for your time.
You bet, sir. The next department item we have is another item to approve amendment number 1 to the Lewis County Health Officer Services contract for 2019 services. And I'm going to turn to Director of Public Health and Social Services, Shelley Slaughter, to give us a little bit of background on this particular action. Shelley?
Thank you, Chair Blake. Good afternoon, Commissioners. This item is to request that you approve an amendment that we have with Lewis County for Health Officer Services. Lewis County and Thurston County both need health officer services. Lewis County contracts with us to provide Dr. Wood's time 1 day a week, 8 hours a week approximately, to provide their health officer services. The Lewis County Board of Health has reviewed this amendment and is requesting that once again Thurston County approve this authorization so that we can continue providing health officer services in partnership with Lewis County. Our fiscal department has reviewed and anticipated any additional costs that Thurston County may incur by employing Dr. Wood on behalf of both Thurston and Lewis County, and that's reflected in the amendment amount that we are requesting, which is $47,432. Any questions?
Any questions of Shelley?
No, Shelley, thank you.
And, yeah, we've been doing this for 5 years?
Yes, 5 years.
Okay, thank you. That's it.
Okay, good. Here's a motion.
Move to approve and sign amendment number 1 to the 2018 Lewis County Health Officer Services contract for the revised duration of January 1, 2018 through December 31, 2019 for a total additional compensation of $47,432, and authorize the director to sign any amendments that do not revise the compensation or duration of the contract by more than 25%.
Second.
It's been moved and seconded as stated. All those in favor say aye.
Aye.
Aye, and that motion carries. So we'll move to item number 7, and I'll just ask real quickly if there's any kind of health issues you've seen or want to talk about.
Well, the only thing I'd like to talk about is water quality.
Okay. And what would you like to say about that?
Water quality involving Capitol Lake cleanup, Puget Sound cleanup, the excessive nitrogen level in the Deschutes River, and that was my health activity for the week. Thanks. That's it.
No, nothing.
Nothing either. Okay, great. So we'll move to number 8, which is the director's report, and I'll turn to Shelley, Director of Public Health and Social Services, to give us her report.
To give Dr. Wood a little bit more opportunity to speak today, but I want to share with you some good news, which I know you are aware of as the Board of County Commissioners, but I want to also share with the Board of Health that last week our Nurse-Family Partnership and Maternal Child Health Program received an award from Fight Crime, Invest in Kids for the incredible work that they do to advance home visiting with the Nurse-Family Partnership Program in the last year. Particularly Gretchen Toller and Kathy Sherman were recognized for working with legislators and policymakers to help advance home visiting, which helped everyone statewide. This program makes an incredible difference in the lives of families and children for generations to come, and I just wanted to be able to thank again all of you for your support of that program. The award was given to Thurston County for their support of that program, and we're very proud as the only recipient in the state to receive that great honor.
Very good.
Beautiful.
In addition, Kathy Sherman, one of our nurses with the Nurse Family Partnership Program, has been nominated to receive the Thurston County Angel Award from the Thurston County Early Childhood Coalition. And so next Wednesday, she will be honored for the work that she has done and the impact that she has had on the mothers and children that she serves. So wanted to share that. In other news, we received a report of a white powder incident yesterday at a local state agency. We have a public health duty to respond to that with both our health officer and our public health emergency preparedness team. We responded and provided support with that incident, and I just wanted to share that in the end, we learned that the substance was non-toxic, and there were 4 people exposed to that received preventative treatment, but we luckily learned that the substance was not dangerous. We're using this as a learning opportunity. We will be working with Thurston County Emergency Management and the other partners involved to hold an after-incident action report so we can debrief and plan for future incidents. We also investigated some increased reports of opioid overdoses over the last month. We received some very concerning information from law enforcement on and emergency medical services from various overdoses that they responded to. Our epidemiologists have been looking at that data. At this time, we see that there's an increase over the last month. We are going forward to figure out how we can assess whether this is an unusual increase in overdoses or not, and working together with our partners that are part of our Thurston County Opioid Task Force moving forward to better share data and get a baseline so we can track and get information to the public so that they can protect themselves and receive treatment if they are impacted by the opioid issue.
Okay, Shelley, were those opioid recoveries or deaths?
They were recovered by naloxone distribution at the scene and some at the hospital as far as I know. So I am not aware of any opioid deaths that have happened in the last week, but in the last year we have had many, and so we're working together with our partners on that, and we'll be sharing more information with you as part of our Thurston County Opioid Task Force, which met last week and began the first phase of working on developing the plan. So the Opioid Task Force will meet again on December 3rd at Thurston County Public Health Department at 3 o'clock on Lily Road. So we invite people who may want to participate in that to please join us. We are also still monitoring 6 different lakes for toxic algae in Thurston County. We still have 1 advisory for microcystin at Pattison Lake. We'll continue to monitor that through November. And over this course of this year, we've investigated 10 different algae blooms. And I think that is the conclusion of my report, unless you have any questions.
Mm-hmm.
Thank you.
No,
I
thank
do.
you.
Just to add a comparable comparison, you might want to look at Kitsap in the same time frame. I heard they had a half a dozen or so opioid incidents. I'm not quite sure, but just maybe in the bigger scheme of things. So.
Yes, looking at that information regionally is really important. The state is looking at that as well, and again, we're trying to assess the best way we can track all of that to prevent overdose deaths from happening. And we're very glad to have naloxone as a response to save people from dying, but we would like to further prevent that, and it's really important that we're working together with our local counties and partners in responding and planning so we can prevent.
And when it comes to tracking the opioid overdoses, we're talking about the entire county, not just unincorporated.
That's right.
We're talking about each city and jurisdiction, because Olympia, wasn't it Olympia just reported a whole bunch of, that was in the paper of record?
Yes.
Overdoses and bad junk out there.
Yes, that was one of the reports that we received and we looked into at Public Health to determine what what kind of the trend is and what was happening with that.
So as a Board of Health, we're on that.
Yes.
Got it. Thank you.
Thank you.
All right, Dr. Wood, do you have anything?
Yes, I do. I'm happy. Oh. Can you hear me?
I can hear you.
Okay. I just wanted to add to what Shelley was saying. Not all, there can be multiple drugs in overdoses. So there can be stimulants, and unfortunately, they can also be laced with opioids.
Oh, yeah,
So-
absolutely.
So there's unfortunately drug cocktails sometimes
Yeah.
that may contribute to overdoses and to deaths. I wanted to talk about acute placid myelitis, and this is...
Is it muted? Your voice, is it muted?
Thank you.
There we
I
go.
still hear you.
Oh, can you hear me now?
Oh, even better.
Yeah, better, yeah.
Good. I wanted to talk about acute placid myelitis. The bottom line up front is that we still don't know what's causing it. The other bottom line up front is that 75% of the cases are in children, and they appear to be occurring cyclically. They first came to our attention in 2014 nationally and here in Washington State. And I believe you have, Lydia, is this on a slide or is it on the laptop?
This is the paralysis type?
Yes. So I wanted to tell you what it is. It's a rare condition with sudden onset of weakness of one or more of the limbs, upper, lower arms and legs. Sometimes also there's weakness of the eyelid muscles, of the muscles that help you swallow, and most unfortunately, it can affect, in some people, the the breathing muscles, and that's not good. It has been associated with cold symptoms, and then within 2 to 10 days, parents are reporting that their children are suddenly unable to move a limb. The range of severity can be a weakness, or it can be you're completely paralyzed. And recovery, you can have some recovery, but in some cases the recovery is quite limited. They've looked, currently CDC has expert neurologists looking into it. I can tell you that this year in Washington State, we have had a total of 9 reported and 5 confirmed. And that's why there's a delay, because they have to, there's very many specimens of body substances that get sent to CDC and evaluated. They're looking for viruses, they're looking for environmental toxins, they're looking for what's called autoimmune, where the body attacks itself. It doesn't recognize itself as protected and attacks itself. And we don't, there's no consistent presentation of any one causal factor, which is really frustrating and also scary. I would say that it's very rare even now, despite the fluctuation, the peaking, that less than 1 in a million people are going to be affected by it. But if you're that one, then it's 100% for you. Yeah. So I'm happy to answer any questions. It's not related to polio. People have been concerned about that. And there are other viruses similar to polio that they felt in 2014. There were 120 children affected in the fall of that year. And they felt that there were many of them did have what's called an enterovirus, which is a virus that affects the GI tract. But it didn't show up in every single one of them. And so they don't, and subsequent years that unfortunately have happened, they found a different virus that may or may not be associated. So there's not a causal agent. The message CDC and the State Department of Health and we are putting out is that it's good to be up to date on your vaccinations, including your polio vaccine. It is also good to protect yourself from mosquitoes because that's another possible causal factor, but we don't have it definitely that it's West Nile virus or anything like that. But that is one of the possible agents that may be contributing to these cases. And finally, so avoid mosquito bites, and that's less important in November than it is in August. But when mosquitoes are around, it's important to use repellent, stay inside at dawn and dusk, and wear protective clothing, and empty out all the like the bird baths, et cetera, that may collect water that the mosquitoes lay their larvae in. And finally, wash your hands and don't touch your face. Just the usual messages that we give for trying to prevent people from spreading disease. So is there any questions with regard to acute? Yes, Commissioner Edmonds.
Any indication of this taking place in other countries? Or, I mean, it seems like September seems to be the spike on each one of these. I don't know, school starts, you know, in September.
Yes.
And I don't know if that's got something to do with it, but what about places like Mexico or Canada or Europe or anything like that?
I have not heard of anything like that occurring. We get reports weekly from the state about outbreaks of diseases such as Ebola or meningitis, and I have not heard anything about this, unlike Zika, which we get reports on but that's a great question. And just as for the nation, we've had this cyclical appearance every other year. That's in Washington State. As I said, there are currently 9 reported, 5 confirmed. There were only 3 in 2017, but there were 10 in 2016, none in 2015, and 3 in 2014. So it appears to be going on the cycle, and they're monitoring the disease activity, testing specimens, and the reason there may be more announced nationally because when I was looking into this, there had been 62 cases reported nationally, but there were 62 confirmed, but 127 reported. So they're looking to see if it meets the case definition by having the neurologist check the specimens out. So there's a little bit of a lag time between when the report gets to the Centers for Disease Control and when they confirm it. So.
Doc, you said in 2014 the cluster was in the fall, and unless I missed it, there's been the pattern every fall, or does it happen all throughout the year?
It tends to be in the fall, yes. The cases, the reported cases that we've had in Washington State have all occurred since the 28th of August.
I see it now.
Yeah, no, thank you.
Thank you. I couldn't read it from there.
So, you know, it does make you, well, could it be mosquito-borne? Because we have mosquitoes in the summer and then people are, or is it something else? Because often people, as I said, they're sick beforehand with the snuffles, and then, you know, they start not being able to move a limb.
Anything else?
No, thank you.
Nope, thank you.
You have anything else, Shelley? Nope. I have a small request for the both of you, Shelley and Dr. Wood. For Dr. Wood, where Jacob was asking for some assistance in some way, can you do an all-call to the community as a whole, to physicians and what have you, that a support system is out there for male?
Oh, that's great to know about.
Yeah.
Yeah.
Through your contacts, networks, what have you, so that be more aware, and anybody who might be able to participate to help him as the, I guess, the leader of the coalition, right?
Yes.
And then can we post these on our website? Because he was saying they don't have even something on the state website. I understand that one, but can we post documents like this for mail? I don't know if we have a link or not, but just to kind of get an awareness piece going that way. So.
Yes, we'll get them posted on the Thurston County Public Health website, and we'll also share it on our social media accounts.
There you go. That's what I'm looking for. At least start that. Okay. Anything else?
No, I think that's it.
Yeah.
Thank you.
Romero, you have anything? Lydia, anything? No? Okay. Is there a motion to adjourn?
Yeah, I move to adjourn the Board of Health meeting, November 6, 2018.
Second.
We move the second to adjourn. All those in favor say
Thank
aye.
you.
Aye.
for getting
Aye, we are adjourned.